Would you like me to introduce myself and a little bit about me and like that?
Yeah, go ahead.
Okay. So I am Dr. Michael Schmidt. I'm a doctor of chiropractic, and I also have many hours of additional training to receive my diplomate of the American Chiropractic Board of Neurology. Um, that deems me as a chiropractic neurologist. I grew up in small town Missouri. I went to St. Louis for chiropractic school, and then I went to Florida for a couple of years to complete sort of a residency program for my neurology program.
That's a great introduction. And I'm Paige Speers of Choose Greater Health, connecting brain injury survivors with resources they need that they haven't gotten elsewhere. And in terms of that us brain injury survivors find relatable, how does your initial evaluation differ from conventional neurology, and what are the factors that help you determine in assessment which treatments to proceed with?
Well, first, I thank you, Paige, for having me on here to spread the word a little bit on different techniques and things that are available to people out there.
Exactly.
Whenever we're looking at my initial evaluation and how it differs from conventional neurology or medical neurology, initially it doesn't differ much at all. We all do a similar exam, very similar exam. We all know the same exam stuff. We know what areas of the brain are affected when there's issues with each one. Medical neurologists are more looking at structural damage. We want to make sure that there isn't any severe structural damage or any bleeds or anything stroke-wise going on in different areas and get those under wraps first. And then mainly how we proceed as a functional neurologist or a chiropractic neurologist is during our exam, we may see that someone feels a pinwheel sensation different on the left versus the right side of their body. They may perceive vibration on the left versus the right side of their body differently. And then what we do is we apply a stretch, we apply an exercise or an eye movement to try to change that perception to make them more equal. Okay. So it's not necessarily, hey, they can't do this. It's they can do this. It just feels a little different. It doesn't feel the same on each side. We all look at trying to localize different areas of the brain and how they're functioning and working, and what areas are working well, what areas are not working as good. And then there's various sensory things we can do or specific exercises we can do to target those areas of the brain to try to improve the function and the health of those areas, along with relieving any symptoms that patients may have.
That sounds great. And continuing the thought, what common root cause imbalances can functional neurology identify and treat in a customized way that builds on and adds to traditional PT?
That's a tough question. But the main thing is that we use neurological findings as our basis, right? So we will find an exam item that is a neurological problem, whether they can look one way or the other with their eyes, whether they can't, whether they can do it smooth and accurately, whether they can look this side to this side very accurately and fast. We compare those, and those are neurological findings, and then we apply maybe a physical therapy thing or an eye exercise or a neck stretch, arm stretch, something like that, and then we recheck those findings to see if we had a beneficial effect to that area of the brain. PT looks more at ranges of motion, muscle tonicity, which is all good stuff because we do too. But we try to look at, are we affecting that area of the brain appropriately? Because the brain trumps all, right? The brain controls everything.
Yeah.
Did I kind of answer that question for you a little bit?
Yeah, sounds great. And
Awesome.
what made you want to enter this field of study with functional neurology? And what did you notice in your family, community, and region that they were asking for that sparked your interest in starting a practice in Centralia?
Well, when I went to chiropractic school, there was a lot of people were getting a lot of really cool results, and they were changing a lot of pretty cool things with just chiropractic adjustments and stuff like that. But my problem was, is I kept asking the why. Why are you changing this? And how are you changing this? And what does that even mean? Like, how does that work? So that's what led me to looking more at brain and like neurological findings and making sure and being able to do a neurological test and stuff like that, and then applying an adjustment or an exercise to change that. There's a lot of things out there that are tough to explain, but if you're looking at the neurology of things and you do a very good exam and you have diagnostic tools that you can use to look at neurological findings like eye movements or balance, and then you can apply a change and then retest those and see a beneficial outcome, you know you're doing the right thing. There's no guessing, you know. If you check somebody's heart rate and blood pressure before you apply an exercise or a stretch, and you change that after you do that stretch or exercise, you change the blood pressure or heart rate, you know you had a beneficial effect. So it's always like a check something, apply an exercise or something that's going to make the brain connect a little bit better or a little bit stronger, and then recheck those findings to see if you made a beneficial change. That's what really got me into functional neurology, because I started seeing people around the United States that were doing this stuff. So I started traveling. I started meeting these people. I started learning what they did and how they were doing it, and the types of patients that they were helping that was really hard for other people to be able to help. So it's just really rewarding to be able to help people at a very, very high level. It's very rewarding.
Sounds good. I have my restoration shirt on today.
Nice.
And
Gotta
I will also
support.
be talking to Dr. Taylor, that's his first name,
Yes.
of Restoration Chiropractic. And what can we do to bring this knowledge and information into more of the mainstream medical communities?
To do that, the word just needs to get out. So stuff like what we're doing right now, that's what's doing it. That's getting the word out. That's going to get people, that's going to raise people's attention. I work with numerous medical providers and nurse practitioners and stuff because they've taken a little faith in me, and they've sent people my way. And then I've actually been able to help them, which is always nice. And then now we have a great growing trust relationship that we can have co-talks with different patients and be able to help them at another higher level. Because in the end, it's all about how can we help someone better and faster and actually that kind of stuff. So it's really important that we keep getting the word out. Doing stuff like this is definitely a good step in the right direction.
Yeah.
And that's really good. And then helping people is huge too, because when you help somebody, they're going to tell people about it, you know? So if this stuff didn't work, there would be no word at all out. And
They knew
starting
about
to
you at Restoration, and also talking to the brain injury support groups is a great thing too. And
Absolutely.
I learned a lot about functional neurology and functional medicine from online summits with other speakers and practitioners, including Dr. Schmidt, who you did some work with in Minnesota.
Yes, yes.
Mm-hmm. And to wrap things up, for someone who may be struggling with a brain injury or some kind of other challenge, what would you like to say to give them hope? And what do you recommend for those interested in experiencing your line of treatment?
People experiencing these kind of things, you just got to have a little faith. Be okay with jumping out and trying something different. Because right now, this stuff is outside the box because a lot of it's not super understandable and explainable. But we're writing case studies on patients. We're writing research. We're trying to get the word out. We're trying to make it understandable. Just have a little faith sometimes and jump out of the box and try to find somebody with the qualifications of a diplomate of neurology. And in order to do that, what you can do is you can go to a website. This website shows everyone that has ever received this diplomate status in all the different states. It's called www.acnb.org. If you go to that website and type in your state, you will have a list of practitioners that have this qualification. And that is a very good first step in getting exposure to chiropractic neurology with clinical neuroscience bases, practicing functional neurology.
That's excellent. Good to know. Thank you so much for your time, Dr. Schmidt.
Thank you for having me on here, Paige.
You bet.